Welcome to the Omni Dental Podcast. We are diving straight into your source material today, the 2026 Oral Health Resolutions, your guide to a healthier smile. And you tasked us with a very specific mission here. It's about treating our dental goals. Well, not as an afterthought, but with the same seriousness we'd apply to, say, a new fitness plan or a major career goal. That framing alone is pretty compelling.
It absolutely is, because the guidance here, it immediately establishes that oral health is a vital component of your overall long-term well-being.
Right. It's not just about a nice smile.
Exactly. It's about systemic health. And what's fascinating is the emphasis on starting now, in late fall, not waiting for that January 1st deadline.
So you get a head start.
You do. The sources tell us that if you start with small, consistent improvements now, you'll enter 2026 already ahead of the curve.
And these improvements are genuinely accessible, which I like. It's not about expensive interventions, it's about foundational habits. Now, before we get into the 5 resolutions themselves, let's just briefly set the context. This whole roadmap comes from the experts at Omni Dental and Medspa, who are located in Arlington Heights, Illinois.
Precisely. They've really synthesized a clear path forward. So let's unpack those 5 steps, starting with, well, the very foundation.
Okay, let's do it. Resolution number 1, the absolute cornerstone. Commit to regular brushing and flossing. Now, this sounds obvious, but the source insists that consistency and the correct technique are where most of us fall down.
That's the real insight. It's not just that you brush, but how you do it. The sources specify brushing twice a day, flossing daily. Those are the non-negotiables.
Okay.
But the detail that makes this a deep dive is the technique. To really get plaque off, you need a soft, bristled brush, fluoride paste, and you've got to aim the bristles at a 45-degree angle toward the gum line.
Oh, okay, so there's a specific angle.
Yes. It's often called the Bass method. It ensures you clean the sulcus. That's that crucial little groove where the tooth meets the gum.
I appreciate that nuance. It makes the whole 2-minute rule feel less arbitrary. It's 2 minutes of doing something specific, not just scrubbing away. But what about flossing? People often treat that as optional. Does the source give a really compelling reason not to skip it?
It does. Flossing, or using an interdental brush, is literally the only way to physically break up the colonies of bacteria living between your teeth.
The only way.
The only way. Brushing just can't get in there. So if you skip flossing, you leave roughly 35% of your tooth surfaces uncleaned.
35%. Wow.
Yeah, you're basically guaranteeing tartar buildup and eventually gum disease. It's a mechanical thing where the brush just can't reach.
That's a powerful stat. If you're leaving a third of your teeth dirty, you haven't really brushed. Okay. That moves us to resolution 2, which is less about mechanics and more about your body's defense system. Stay hydrated for oral health.
This is so often overlooked. And what's fascinating here is the role of saliva. Water is essential because it keeps the mouth moist, which lets saliva do its job.
And what exactly is its job?
Well, saliva is naturally alkaline, so it acts as a buffer. Every time you eat or drink something sugary, bacteria produce acid, and your mouth's pH drops.
Okay.
If your mouth is dry, that acid just sits there. But if you're hydrated, saliva quickly neutralizes it, minimizing the time acid has to, eat away at your enamel.
So sipping water throughout the day, especially after a meal, is like giving your body's natural defense system a constant resupply.
A very simple, very high-impact change, yes.
That's a great takeaway. Now we get into the dietary side with resolution 3, reduce sugar intake. We all know sugar is bad, but let's go a little deeper.
We have to. The source calls sugar the significant enemy because the rate you consume it matters just as much as the amount.
The rate? What do you mean?
I mean, constantly grazing on sugary snacks is way worse than eating one dessert quickly. When you eat something sweet, your mouth stays acidic for about 20 minutes, right?
So if you sip a soda over an hour, you're giving your teeth a full hour-long acid attack.
So it's not just the sugar, it's the duration of the exposure. That makes total sense.
Exactly. And the source suggests good alternatives like fruits, nuts, and this one's great, cheese.
Cheese.
Yes. Chewing cheese stimulates saliva, and its calcium helps neutralize acid and even remineralize the enamel. It's a true power snack for your teeth.
That's amazing. And that leads us right into the broader dietary resolution. Embrace a balanced diet for stronger teeth. We're talking about actively building up defenses here.
We are. We focus so much on what to avoid, but we need the building blocks. If you want strong teeth, you need foods rich in calcium, phosphorus, and specific vitamins.
To build the enamel itself.
Exactly. It's like supplying the raw materials for your body to constantly repair and resist decay. Your dental shopping list should just be your general health shopping list. Fruits, Vegetables, lean proteins, whole grains.
Simple enough. If it's good for your body, it's good for your teeth. Now, we do have to address Resolution 4, which for some people is a really significant lifestyle change. Quitting smoking.
Right. And this one is non-negotiable if it applies to you. The dental consequences are severe.
And it goes way beyond just staining. The chemicals in tobacco smoke cause specific physiological damage.
How so?
Smoking severely constricts the blood vessels in your gums. This is dangerous for a couple of reasons. First, it starves the tissue, making it harder for your body to fight off infections.
So you're more susceptible to gum disease.
Much more. But second, and this is really dangerous, the reduced blood flow can actually mask the early symptoms, like bleeding gums.
Oh, wow. So you could have a serious infection developing and not even know it because you don't see the warning signs.
Exactly. Not until the damage is really, really advanced, it just tanks your body's ability to heal and sends the risk of gum disease and oral cancer through the roof.
That's terrifying. Okay, that brings us to the fifth and final resolution, which is the professional part of the equation. Schedule regular dental checkups.
Yes, this is where prevention really pays off. The sources strongly recommend scheduling at least 2 checkups this year.
At least 2.
And this actually gives us a great little rule to remember, the 2-2-2 rule for teeth. Brush twice a day for 2 minutes and see your dentist 2 times a year.
I love that. 2-2-2. Very easy to remember. And the dentist's job isn't just cleaning, it's about early detection, right?
Absolutely. The professional cleaning gets rid of tartar, that hardened plaque your brush can't touch. But even more importantly, the dentist is screening for silent conditions, like that masked gum disease we talked about, or even oral cancer, catching them early.
When treatment is simplest.
And most effective. Preventive care is always, always cheaper and easier than restorative care.
That is the absolute truth. Okay, we've covered the 5 core resolutions. Now let's shift gears a bit and talk about the provider of this guidance, Omni Dental and Medspa.
Right. They're located in Arlington Heights, IL, at 305 E Rand Road. And it's clear they look at the patient as a whole person, not just a set of teeth.
And the practice is led by Dr. Bilas Poles. The source material really highlights his expertise, especially in treating dental injuries and emergencies. That's a specialization that really matters when you need it.
It does. And what's interesting is their patient-first philosophy. They talk about personalized plans, comfortable appointments, and treating everyone from toddlers to seniors like family.
That approach is so important. Now, looking at their services, it's a huge range. Under general dentistry, you have the basics like deep teeth cleaning, but also more advanced things like gum disease laser therapy.
But then they go way beyond that. They handle the really serious treatments: root canal therapy, tooth extractions, bone grafting, even custom sleep apnea appliances.
Which shows they're equipped for complex issues. And they also have a really robust cosmetic and implant side. We're talking full dental implants, including things like the all-on-4 technique.
Which is a full arch replacement. That's a major procedure.
A very big deal. Plus Invisalign, teeth whitening, full smile makeovers. But this is the part that I find fascinating, the Medspa component. The inclusion of advanced aesthetic services.
Right. It really reinforces that idea that dental confidence is tied to your overall well-being. They're connecting the aesthetics of the smile to the aesthetics of the face.
It's the whole package, and they get specific. They list injectables like Botox and fillers, but also things like Sculptra and platelet-rich fibrin or PRF.
Yeah, let's pause on PRF for a second.
Please, why would a dental practice offer that?
Well, PRF uses a concentration of your own blood's healing factors. It's used to speed up tissue and bone regeneration, especially after things like extractions or bone grafts.
Ah, so while it has aesthetic uses, here it's about better, faster healing.
Exactly. It's advanced technology supporting recovery. Then they also have skin treatments like hydrofacials, body sculpting. It's a true fusion of clinical and aesthetic care.
And they serve a pretty wide area, too. They're based in Arlington Heights, but they also serve Buffalo Grove, Palatine, Mount Prospect, Schaumburg, a whole list of nearby communities.
Wheeling, Des Plaines, Elk Grove Village, they have a big footprint.
Okay, let's pull back and summarize the key takeaways. Our mission was to take these 2026 resolutions seriously, and the path is all about consistency.
Absolutely. It's about mastering that 2-minute 45-degree brushing, understanding how hydration works for you, being smart about sugar timing, and committing to that foundational 2-2-2 rule.
And prioritizing your oral health is just a massive investment in your general health. The connection to preventing systemic disease is it's undeniable.
It is. And here's a final provocative thought for you, the listener. We talked about the 2-2-2 rule, but your source material also mentioned something called the 3-3-3 brushing rule.
Ooh, I saw that. What is that?
Well, I'm going to challenge you to research it. It has to do with the frequency of care right after you eat. How long should you wait to brush after a meal? The answer builds directly on what we discussed today about pH balance.
That is an excellent final challenge. And if you are ready to take these resolutions to heart and schedule that crucial next step, your professional checkup, you can contact Omni Dental in Arlington Heights, IO. The specific number to reach them is 847-483-8833. We look forward to seeing your healthier smile in 2026.